Hey everyone, happy Thursday. I'm Nicole. Hi everybody. My name is Nicole. I am the registered dietitian at Dr. Asamoah's office. We are live today with Back to Basics episode 32, and we are talking about the magic potion for dealing with Candida overgrowth. So today I wanted to have just kind of a candid conversation to educate you a little bit about what Candida is, or yeast, um, and to encourage you guys to ask questions. Um, and I could answer while we're live today, hopefully, if I know what I'm doing. So let's talk a little bit about all the way back to the beginning. So what is Candida, or what is fungal overgrowth, SIFO, right? You guys may have heard of SIBO. We've done a topic on SIBO. We may have threw around the word SIFO, right? Small intestinal fungal overgrowth. And that is kind of the category that Candida is in, right? So when we talk about fungus, right, your body has a microbiome, right? But it also has a mycobiome, right? So it has a bacteria environment, and it does have a natural fungal environment as well, right? One that we live in harmony with for maybe many years of our lives until something is disrupted and it decides to blow up and overgrow, right? So what causes the fungus to blow up and overgrow? There are many reasons. Some could be age, right? It could maybe be your genetics and your body's ability to detoxify itself. It could be your immune function. How robust is it, right? It could be your diet. It could be medications that you've been taking, things like antibiotics, right? And it could actually be the actual flora of your bacterial microbiome, right? That in itself could create an environment in which fungus can flourish. So it's something to think about, right? So the microbiome itself, most fungus don't really colonize the body, and we'll talk about the main one that we see in most of our clients in a bit. Um, they like environments that are physiologically the temperature that the human body is. So we are a prime breeding ground for fungus, right? There's different funguses that flourish in acidic environments like your stomach, and other ones that like more alkaline environments like your intestines. So that's something to think about, right? It's something that Dr. Asamoah and myself have to think about when we are targeting your therapeutic plan. So of the all of the flora of fungus that could be colonizing your body, Candida is the primary colonizer of the human body, right? We have anywhere from 30 to 80% of the population have Candida inside their body, right? Most of us tend to get this as infants through the natural birthing process, right? Um, the thing about fungus or Candida is that they don't really need a lot of oxygen, right? They don't need a male and female to reproduce. They thrive in warm, moist environments, like inside of our bodies. And so again, just reiterating this fact that we are the prime breeding ground, right? They don't need a male to proliferate. They just split apart and split apart and split apart, which makes it part of why it's so difficult to eradicate them. Most of the Candida species that can infect our bodies or infect's not the right word, that live commensally in our bodies are harmful, right? There is no evidence that shows they have any positive contributions to health. They just are kind of there, right? But that doesn't mean that they don't have a positive contribution to health. It's just one that we haven't quite discovered yet through our research. And that's the thing about research, is that we're constantly finding new things, right? So one of the reasons why I think it's really helpful to be a part of this community, because we come in and we give you some of the more new research that we come across, so that way you guys are up to date with the most recent research. The other thing to think about when we're talking about Candida itself is that they adapt really quickly to the environment, right? This is one of the other reasons why it's very difficult to kill them. They want to live, and they leave with a fight. The thing about Candida as well is, yes, we are talking about more kind of digestive system, right? Sources of Candida, but it really could be systemic, right? You can have Candida in your mouth. Think of maybe a good image that you can have in your mind is, sometimes infants will get what is called thrush on their tongue, and it'll look like they have kind of this white fuzzy patch on their tongue. That's Candida. When Dr. Asamoah does endoscopy, she could see if you had Candida in your esophagus, right, as she's doing the endoscopy. You can have it in your digestive tract, which results in, digestive upset, the changes in your bowel movements, diarrhea, gas, bloating, which is difficult, right, in the sense that the symptoms mimic many other things, right? So that's where those specialty tests and those diagnostic tests come in handy, for us to really tease out what is truly going on, so your therapeutic treatment plan is right for you, right? That's why not every single therapeutic food plan, like everybody doing the elimination diet, or everybody doing the specific carbohydrate diet or the low FODMAP diet, it doesn't necessarily work for everybody if we're not targeting the right basically bug, right? I've had a client who had really a bad kind of nasal fungal infection that was just really hard for her to get rid of. And she was using a combination of conventional treatment and functional treatment. And eventually, we just had to go in, not we, but her specialist, her nasal specialist, her sinus specialist, had to go in and kind of do a scraping, and hopefully, kind of getting a good majority of that fungus colonization out, right? Let's see. So some of the, what is the word I want to use? Some of the it's not symptoms, I guess diagnoses that can be associated with Candida overgrowth that is often overlooked by conventional doctors are things like diabetes is often associated with Candida overgrowth. Chronic stress can be associated with it. Hormone imbalance, right? We see quite a few people who in addition to their gut issues, have hormone imbalance. Leaky gut, right? Dysbiosis, just these type of symptoms and these type of diagnoses. Individuals who have a high refined carbohydrate diet. I got a question a couple of days ago about what is a good and a bad carb, and I'll get to that in a little bit, and get on my soapbox a little bit. People who have high alcohol intake, right? I worked a little bit with individuals, with a good friend of mine who works with addicts or alcoholics, and our biggest conversation was lowering the carbohydrate intake, because it was almost just as addictive as their drug of choice, right? Feeding kind of the dysbiosis and the urge to want it and want it and want it, right? So again, just reiterating that Candida overgrowth can be all over your body, fungus infections, vaginal yeast infections, and these may be isolated to those different parts of your body, but they can also be a sign that maybe it is systemic, especially if you already realize that you're having some symptoms digestively, right? So it's worth looking into. One of the things that we do with our clients is if we're suspecting Candida, we'll give them this like 2-page questionnaire to go over that's asking them, symptoms that are typically associated with Candida overgrowth. Things like the vaginal yeast infections, or are you having lots of brain fog, or are you what if your bowel movements have changed? And at the end, they get a compiled score. And that score allows us to see, or gives us at least some sort of subjective data in which direction we should take their treatment plan. So I posted earlier this week, but just to kind of review, some of the symptoms of Candida overgrowth include things like fatigue, gas and bloating, leaky gut, changes in your stool consistency or habits, right? If you're commonly having diarrhea and now suddenly you have constipation, or vice versa, right? It's a sudden change. Reoccurring local yeast infections, that's what I just mentioned, right? Kind of the reoccurring yeast infections, or a toenail fungus that just won't go away even with treatment. Other things include chemical sensitivities, right? Like walking into a room and not being able to stand the smells that are in there, or perfumes are just really nauseating to you, or those type of things can really be a hindrance in the quality of life of some clients. And things like depression, right? Sometimes people look at depression as just as they don't never, in my experience at least, I worked with a group of therapists and did an eating disorder clinic for a while. And it seems like depression always had kind of like a life story type of thing, which yes, maybe a good majority of the time it does, but it can also be more systemic as to why depression is maybe at the level that it is, or the intensity that it is. And it's not looked at enough, right? Dietary responses to depression, this overgrowth or this dysbiotic kind of associated with depression, micronutrient association with depression. And many people, if we kind of manage that, they may not need the other more kind of stronger medications that lead to more side effects, or things that where they've been on it for years and feel like they can't get off of it type of thing, right? I feel like that area of society needs a little bit more functionally thinking practitioners. A couple of things that in my research for a presentation today that I thought was really interesting is this association with Candida overgrowth and celiac disease, right? Candida itself actually has a protein that's very similar to gliadin, which is a protein found in gluten. And so it may trigger this anti-gliadin antibody, and they may have symptomatic similar to if they had eaten gluten, which is pretty interesting to think about. Another one is associated with individuals those of you who may be watching back or watching currently, who have IBD, right? Irritable inflammatory bowel disease, things like ulcerative colitis or Crohn's disease, right? Higher association for Candida overgrowth, and they're not really looking at it, and doctors aren't really listening or doing that other research. And I don't think it's any fault of their own, right? It's more of, where are you looking at the research, right? Because if you're not looking broadly and you're looking kind of at the same stuff that you've always looked at, you're not going to see it, right? And so that's something that I think just as practitioners and when we're teaching practitioners to be, that area could be changed maybe, or evolved a little bit. We see a lot of you guys that have peptic ulcers, right? Ulcers in your stomach, that can be associated with Candida overgrowth, because Candida, some forms of Candida, actually like acidic environments of your stomach. Right? Candida arthritis, Candida esophagitis, dermatitis, asthma, all of these things can be associated with Candida overgrowth. So that's Candida overgrowth in general. The most common form of Candida that we see in our clients is a form of Candida called albicans, Candida albicans. And so when we are doing testing or, and I'll get into that a little bit more in a second, that's the specific strain of Candida that we're looking for. Sometimes the testing needs to be more specialized because maybe your infection or overgrowth is a different form of Candida, and your treatment plan may need to be adjusted based on that, right? So the thing about Candida albicans that makes it a little stinky bugger is that it creates what is known as a biofilm, right? And the biofilm is basically like a protective coating over the actual fungus bodies, right? So if we do not attack the biofilm, treatment, kind of antifungal treatment on that Candida may not work as effectively or efficiently, right? So commonly what Dr. Asamoah will do in her treatment plan is treat with a biofilm buster, right? And at the same time treat with an antifungal like nystatin or fluconazole. So we're attacking it at many, many, many different angles, including the dietary angle that we'll talk about in a little bit. Yes, the biofilm is another thing I think that leaves this Candida albicans that resistance. I mentioned earlier that it's a little nasty bugger to get rid of, right? It leaves with a fight. It's one of those type of things. Julian, I'll get to your question in a second. So when I talk about the dietary component of things, I think that's a great question. So I think so treating on a multi-level kind of aspect, right, is really the best way to treat Candida. If you're not treating the biofilm, which we typically treat with herbals, right, you know, it just may not work as effectively, the nystatin, fluconazole, and the other medications that are used commonly. So let's talk a little bit about, let's switch gears a little bit and talk about how we identify Candida in your body. Right? So one of the ways that, there's several ways. Often, we've talked about this before, I believe, or at least some of the tests that we do commonly, at least in our functional medicine program. We commonly do two tests. One is a micronutrient organic acid panel, and the second one is a comprehensive stool panel, okay? So organic acids are very helpful because they're looking for the organic acids, or part of the test is looking for the organic acids of yeast, right? So if you're getting a high level, right, a level that's, whether it's in like the very high level or in the moderate range level, it gives us an idea to investigate further, right? The comprehensive stool test allows us to see if you have a positive Candida, or arabinitol is really what it's, the component from yeast that it's looking at. If it's high in your stool, right, your fecal samples, it gives us a really good idea that your actual intestines is affected, right? Because the organic acid test is more of a blood and urine. So that's telling us just systemically you might have yeast around, but where is it actually located? Maybe we don't know, right? Either way, it may result in still treating, right? The other way, and the third way that we test and confirm a yeast infestation or overgrowth is through like a Quest blood lab, right? We will test for Candida albicans antibodies, and if they come out positive, that it either tells us that you have had a yeast infection in the past and your antibodies are still being produced, or that you currently have one at this very moment. Right? So nutrition therapy for Candida overgrowth. Right? There is somewhat of a lack of consensus in terms of which specific therapeutic plan you're supposed to use. But in general, what we use at our clinic is the anti-candida plan. And so in general, this is looking at lower carbohydrate intake. And the reason why, right? Think about when you're using yeast in baking. When you're using yeast in baking, you have to feed that yeast. And what do you feed that yeast with? You feed it with sugar, right? So when you eat a lot of sugar or refined carbohydrates, and even whole grains and things like that, if you're eating it in excess, you're still feeding the problem, right? You're feeding the yeast and it's overgrowing. So even if you're treating, if your dietary habits don't change, you're almost defeating the purpose, right? So we're looking at lowering overall carbohydrate intake for at least 2 to 4 weeks before we start to maybe reintroduce some, but at small portions, right? So typically the anti-candida plan will take out all of the really high sugary fruits and focus more on the low glycemic fruits like berries, right? Your portion sizes and servings of grains will be limited maybe to a half a cup to a cup per day. So it's not eliminating these things out of your diet, it's strategically working your way around them, right? So the question that I got is, what is a good carb versus bad carb, or what should I do, right? So my response to that is, hate's a really strong word. My mom always told me not to use the word hate. I dislike strongly putting a label on anything related to food. I don't like to do good, bad, clean food or clean eating. I don't like to do any of that, because essentially what I have found, especially working with eating disorders, is that it brings an anxiety to food, right? And that anxiety in itself now may lead to more disordered eating patterns. Not an eating disorder, but disordered eating patterns, right? So instead of putting good food, good, bad, whatever, labeling food, I want you to think about your goals, right? What is your goal? If your goal is weight loss, is eating this food helping you towards that goal? Yes or no? That's the question you have to ask yourself. Is eating this kind of carbohydrate helping you towards your goal of eradicating Candida? No, right? So we are taking these out for a period of time so that way my body can heal and get better, and then we will reassess and adjust our diet as needed, right? That feels more empowering, right? It doesn't feel as defeating. It doesn't feel as overwhelming. There's a reason I'm doing this because of this, right? And knowing that it could change should you choose, or should your goals change, makes it less, makes it feel less restricting, right? So that's my answer to that question. So the carbohydrates that you would want to start to decrease while you're on an anti-candida therapeutic plan are things like refined sugars, right? And that includes table sugar, but that also includes natural, right? That includes things like dates, that includes things like honey, that includes things like like applesauce, right? Things that we use to sweeten baked goods and things like that. It includes things like corn, right? High fructose corn syrup and other corn products, really high starchy vegetables, fresh fruit, except for the ones that we talked about that are low glycemic, dried fruit, which is often has that added sugars to it, right? So again, you often restrict from anywhere for 2 to 4 weeks, maybe longer depending on the individual. And then you reintroduce at a very limited portion while you're still treating the Candida. Right? Foods, the other option, so that's one kind of way. There could be another kind of layer sandwiched to the therapeutic food plan, which is avoiding any yeast or mold containing foods. So yeast foods include obviously like yeast, right? Baked goods, nutritional yeast, but also foods that are typically fermented that when I have clients thinking about a really healthy diet, they often include fermented foods, right? Fermented vegetables, kimchi, sauerkraut, those type of things. But if we're treating Candida, it may not be helpful. If you're treating a yeast or a mold overgrowth, which we will use the anti-candida for as well, it may not be helpful either. Being aware of your supplements, right? Yeast-based supplements, sometimes B complex vitamins, often are yeast-based supplements, meaning that the supplement itself is grown using yeast. Alcohol and vinegars are often fermented, but you also have to think about you know, how you're storing your food and things like that, right? Especially if we're thinking about mold. Oh, I'm about to sneeze. Sorry. So, sorry, it keeps coming and going, my sneeze. So fasting regularly, right? Fasting, I think, can be a great component to any person's diet, but I always encourage my clients to be well educated before they start a fasting regimen, right? Because it's not so much, I don't worry about the fasting component necessarily, but it's still important to get enough nutrients in your eating window, right? And often I find people who don't educate themselves on the idea of fasting are unnecessarily restricting their intake because of lack of planning, right? So they're not getting enough protein to maintain their muscle mass. They're starving, so by the time they eat, it's like I see food, I eat it scenario. I'm eating everything and I'm overeating when I break my fast. But fasting could be a really, like I mentioned, a really great component to, especially as you're healing Candida, right? Because you aren't feeding it, right? But even just with dysbiosis, having that time where your digestive system does not have to work and pump and digest and move things through, and it's just literally resting and repairing and restoring is key. Courtney mentions that she has eliminated everything that the Candida diet says, but was not told about the biofilm. Should I start the 12-week program once I get, or should I start the 12 weeks once I get the biofilm buster? Are you referring to the 12-week program, or what are you referring to when you say 12 weeks? I think the biofilm buster is a important component when treating Candida, right, as I mentioned. So I would definitely have a conversation about that, especially with Dr. Asamoah, to see what the best course of action would be for you. My other question would be, have you already started the nystatin or fluconazole, or what other treatment plan have you started as well? Let's see. Yeah. So, I think if you are interested in starting and you're ready to start the 12-week program, I would wait until we saw you and we had a conversation, right? To see if you needed to buy the biofilm buster, right? Okay. So you've done the diet for 6 weeks now. Awesome. So I think it would be a great conversation for us to have. If you haven't done the application, I can't remember, your name looks familiar, the 12-week program application, we can get that started for you. So just let me know, okay? Let's see. Last thing that I want to talk about is die-off. So my post for tomorrow is about die-off symptoms. So you guys will be well seasoned when that post comes out. But die-off symptoms can be a real issue, right? When you're treating Candida, especially in the early kind of 1 to 2 weeks. So die-off symptoms can be very uncomfortable, and it could feel like your symptoms are getting worse before they get better, right? As I mentioned earlier, these buggers really don't want to leave, right? They're like, you're killing their biofilm and they're pushing more biofilm out. And so they resist. And when they resist, we see that resistance initially with increases in your symptoms like gas, bloating, lightheadedness, headache, joint pains, but also that is a sign that we are killing them, right? Because when these yeast particles die, they release toxins. And when they release toxins in your system, it causes an increase in your symptoms for a short period of time. They usually last a few days to maybe a couple of weeks or so. So our way to combat that is to use IV treatment. So the IV treatment and sauna treatment. So what this does is particularly is like a detoxification, right? It's taking out the toxins that are causing the symptoms. So IV treatment will help with kind of providing antioxidant support as well as detoxification and flushing. Infrared sauna treatment will do things like help with detoxification by removing the toxins through your skin and sweating. And so those are some alternative kind of treatments you can use while you're treating Candida. Right? Alrighty. So that was kind of the last piece that I think I wanted to discuss, kind of the die-off. So just let's recap for a second. So we talked about kind of this mycobiome, right? This fungus mycobiome, and how it lives commensally in our body until suddenly it's not. We talked about ways that it could become overgrowth and diseases that are associated with yeast overgrowth. We discovered that the Candida albicans is the most common infested or commonly found Candida species in the human body, with anywhere from 30 to 80% of humans having it inside their body. And we talked about the biofilm buster that it creates and ways to combat it with testing, right? Ways to identify it with testing, ways to treat it with nutrition, and as well as treat it with herbal supplements, as well as prescription supplements. So I would say, Julian, a cup of blueberries and a cup of strawberries is quite a bit much for a smoothie. I might use a half a cup of blueberries and a half a cup of strawberries, or a fourth a cup of blueberries and 1 or 2 strawberries type of thing, right? As a way to kind of get that down. And then you also want to make sure that you have a good amount of protein in there, and it's not just a fruit smoothie, right? So adding in, protein powder, adding in, things that are providing you with protein. Smoothies get a little bit complicated in the sense that we're adding so many different things that the sugar content of a smoothie can go skyrocketing in a minute, right? So we're adding in berries, we're adding in maybe yogurt, which has natural sugars in there pretty low. We're adding maybe some almond milks or even regular milk to them, which may be providing some carbohydrates as well. So being very aware, and I would even encourage that you maybe track it and just get an idea of how much sugar or carbohydrates are in your typical smoothie in the morning, right? And thinking of ways that you can back it down. Like, do I really need a whole cup of blueberries and a whole cup of strawberries? Or can I have 1 or 2 strawberries and a fourth a cup of blueberries and it tastes the same, right? Same thing when it comes to bananas. Bananas itself is a pretty high carbohydrate fruit. When I'm talking to clients managing diabetes, that's kind of the first thing that I take out of their smoothies because it's really high, or really kind of cutting back. One of the things that you can do from the grocery store is they sell, if you don't want to do it yourself, they sell already sliced up bananas. And sometimes bananas itself has a very strong flavor. So if you're just using like a couple of pieces of banana, you're still getting the flavor of banana. However, I've heard, well, it doesn't have the same texture, right? Because bananas give it a really silky, kind of thick, ice cream-like texture. And so what I often do is, in my opinion, avocados give it the same texture. And in a smoothie, it doesn't taste like avocados. You're getting healthy fats, lots of fiber, more potassium than a banana. And you could use banana extract for banana flavor, or again, you can use a few pieces of the banana for the flavor. I hope that answered your question in a really long-winded way. Awesome. Do any of you guys have any additional questions? Awesome. Well, I will call that a wrap up for today. If you have any additional questions as you are watching back, or if you think of anything as you're just kind of mulling around the information that we discussed today, please feel free to message in the chat and I will answer all of your questions. To finalize or kind of round up your question, Courtney, I really would encourage that if you have a follow-up visit with Dr. Asamoah coming up, to just bring up your question about the biofilm buster and see what she has to say with that, okay? With that, I will let all of you guys get back to your family and have a wonderful evening. We will see you next Thursday on episode 33 of Back to Basics. Bye.